almost everything I'm going to tell you right now, we've actually known based on research since about 1985. That is, those of us who are keeping on top of research and perhaps doing it ourselves. Carpal tunnel syndrome are the symptoms that come from pressure on the median nerve in the wrist as it goes from the forearm into the hand. There's a narrow space. There's 9 flexor tendons, those that bend our thumb and fingers, and the nerve, and there has to be enough space. A certain percentage of the population are born with a smaller canal, and perhaps in some people the canal gets smaller over time as the bones change in shape, or maybe the tendons enlarge due to activity of a person. In any case, that elevates the pressure. That's been unequivocally proven. Beginning in 1981 at UC San Diego and across the world, many research laboratories repeated the same research because it was taking them by shock, dispelling the myth that all this was caused by people's occupation demands or their activity with their hands. So basically, any treatment that's going to solve a problem has to start at understanding the pathology, or what you call the pathophysiology of the problem. In this case, it has to be able to diminish pressure. Normal carpal tunnel pressure, so we're talking about pressure inside the wrist here, is about 0 to 10 millimeters of mercury. Whereas your normal blood pressure, let's say a lady is probably 100 over 50, or you often hear 120 over 80, which is really the sort of the high end and more common in men. But in any case, so normal here is much less than blood pressure. When a person without the carpal tunnel problem bends their wrist or elevates it, the pressure doesn't change much at all. A person with a tight carpal tunnel, a person who's going to develop carpal tunnel syndrome or the symptoms, bends their wrist down or up, the pressure goes up dramatically. It oftentimes exceeds the diastolic blood pressure, meaning that, so the 100 over 50 exceeds the 50. That's basically strangling the nerve, and it results in the symptoms. So when a person lies down, their heart rate goes lower, their blood pressure goes lower, so all of a sudden their hand starts either aching or going numb, and it will frequently awaken them from sleep. Not everyone has that symptom, but that's the most common symptom, perhaps involving 7 out of 10 of the people who come with carpal tunnel syndrome. So the normal doesn't change pressure, it's low to begin with. The abnormal is elevated, it goes up even higher with extending the wrist or bending the wrist. That led to giving people splints to wear at night. Doesn't help at all during the day. Because the person's got good blood pressure, it's exceeding the pressure on the nerve in the carpal tunnel. People don't generally have a lot of symptoms in their hand during the day. It's usually at nighttime, although a person can have the symptoms during the day. We talk about the myths of treatment of carpal tunnel. It starts with misdiagnosis. The most common misdiagnosis for carpal tunnel syndrome is tendonitis. There's a few kinds of tendonitis in the wrist, and they don't come across like carpal tunnel. And even those aren't inflammatory in nature. So anti-inflammatory medications have no benefit in the treatment of carpal tunnel, either oral or injectable. We don't really understand why, but you get temporary relief with cortisone injections, but that's not a permanent fix, doesn't take the pressure off. And so those of us who are really credible only offer that to a pregnant lady in anticipation that after she delivers her child, the symptoms will maybe go away for a few years, or she can then safely undergo the minor surgery to solve it. So crystals, no benefit. Copper bands and magnets, total malarkey, can't help anything in the body, but particularly don't help carpal tunnel. Chiropractic manipulation might give somebody a relief for a few hours or possibly a couple days. It's not going to affect the long term. It's not going to solve the problem. And again, wrist bracing, no benefit during the day, some temporary benefit for some people at night, doesn't help them all by any means. But there's something called carpal tunnel quell, which is grape flavored Tylenol. Carpal tunnel cream, mentholatum rub. So people have tried acupuncture. Of course, that's not going to affect the pressure either. So it has to lower the pressure. And we know from research using pressure measurement devices and MRI scans that when we release the 2 layers in the carpal tunnel, there's actually 4 layers between the skin and the inside of the carpal tunnel. We release the 2 deepest layers, the pressure is lowered to 0 because the size of the carpal tunnel is increased at 24% on average. And that specific research was published well over 20 years ago. It all comes together. It makes perfect sense from a scientific standpoint. So with the correct diagnosis, the correct treatment, the symptoms go away very predictably. And one of the other big myths with carpal tunnel syndrome is perhaps it's going to come back in many people. What really happens is that at least a third to a half of the people coming with the carpal tunnel problem also have a problem with the ulnar nerve, which is the one behind your elbow, the so-called funny bone. And many of them are unaware of it. The doctors don't check them for it, and nerve conduction studies are notoriously not accurate in examination of the ulnar nerve. It's more of a clinical diagnosis. So if you take the pressure off the median nerve at the wrist, i.e. a carpal tunnel release, then all of a sudden a person will develop the symptoms that have been masked. Those symptoms are a pinched nerve at the elbow known as cubital tunnel syndrome. So the majority of people who think they have recurrent or persistent carpal tunnel actually have untreated cubital tunnel syndrome. And that occurs because of sleeping like this for hours at a time. Very common. And that we know it will actually correct just by changing the way a person sleeps. If given a few months, and it's not too bad at the time, but the person has to reliably do it. So we knew that's one place where a brace will benefit, but the brace is worn in the elbow only at night. And so we have to get a good result with treatment of carpal tunnel syndrome. You have to have the right diagnosis. And in my office, in the offices where there's really an emphasis on doing things the right way and being completely honest and forthright with the patient, a nerve conduction study done properly will prove whether the nerve is pinched or not. And then the person's offered definitive endoscopic carpal tunnel release. If we identify a problem with the ulnar nerve, we immediately educate them on that and have them start wearing a brace, unless it's so bad or there's a cooperation problem, etc., where it's better to do the surgery on both the elbow and the wrist at the same time.